because we do have so much great stuff to cover. So first of all, just welcome everyone again. Really happy to have you all here. And this is the second training workshop focused on planning a successful community-led vaccine event. And this is for the Partnering for Vaccine Equity Learning Community. I'm Bridget Courteau, the Director of Group Learning for the community. And I want to just thank everybody again on behalf of the Urban Institute, which is where I am working. So today's session is the second in a series on vaccine events. Our facilitators designed each workshop session to stand alone. So if you did not attend the first one on May 26th, that's totally fine. But just so you're aware, that first session provided a foundation for planning a successful vaccine event. And specifically, we learned about trust building, relationship building, and making connections with community members, all as kind of a lead up to planning the actual event. So for this session, we'll build on that foundation by discussing the technical and logistical aspects of setting up and running a vaccine clinic that is truly community-led and community responsive. I'm going to introduce our facilitators in a second. I do want to just let you know about a couple of housekeeping issues per usual for our events. So first, we are recording this session. You probably heard the record just start so that we can share the content with a broader learning community. We do plan to edit the video so that it includes just the presentation portions of the session. So we won't include Q&A discussion or anything that happens during that more kind of flexible period. So I want you all to feel comfortable sharing your experiences about your communities and not feel like it's going to be recorded and go out to thousands of people through the learning community. We will splice it so that we're focused on the presentation. And finally, we have a lot of fantastic information to cover, but we do have a few points built in across our 90 minutes together where we'll pause for some Q&A and for some discussion. And though we will have these Q&A breaks, I encourage you to put your questions for the facilitators or for each other into the chat as we go along at any point. And I'll be keeping an eye on those chats and I can raise things at a point where it seems to make sense. I know the speakers will also be looking and we'll try to get to any of those questions that show up in the chat as we can. If there are questions we don't have time to answer, we typically compile those and send them out to the workshop facilitators with the answers that our facilitators will provide to us over email. And finally, the facilitator team has agreed to graciously stay on Zoom for 15 minutes after we end. So if you want a little bit of more direct back and forth with them and you are flexible, then stay on for that final 15 minutes to have some more direct chatting. If you have technical difficulties at any point during the session, you can send an email to our community manager's inbox. I will chat it in a moment, or maybe Sophia can chat it if she's able, but we'll watch the inbox and we'll try to help you as quickly as we can. So now quickly, let me introduce our workshop facilitators so I can hand it over to them. So we have 3 facilitators today, the same facilitators that were in the May 26th session, and that is Lisa Cruz, the Executive Director of the newly formed Multicultural Coalition, formed in October 2020, based on a movement created to acknowledge racial biases and proactively reach communities of color with meaningful communication and actionable services, removing barriers, elevating all voices, and fostering community engagement in a tri-county area in eastern Wisconsin. Patricia, or Trish Sarvella, is the Chief Development Officer at Partnership Community Health Center in Appleton, Wisconsin. Trish is a leader in public health and community development efforts at the local, state, and national levels. And Dr. Pam is the CEO and owner of 4T Business Solutions. She's a consultant, a trainer, a thought leader to several corporations, government agencies, and nonprofit groups, specifically in the areas of cultural competency, equity, diversion, inclusion, strategic planning, and organizational leadership and development. Dr. Pam is also the vice president of the Multicultural Coalition. All right, so I tried to keep that as briefly as I could so that you all can start your great content. So I'm handing it over now to Lisa, I think. Is that right? Lisa, are you getting us started today? Okay, Dr. Pam, sorry about that. Dr. Pam, it's all yours.
Thank you, Bridget. And hello, everybody. We are so excited to have you with us. This is, as Bridget mentioned, this is our second session, but we will touch a little bit on what we covered in the first session just to give you that foundational piece. But we are so excited to be here. with you. And so our first session was really get ready for takeoff, which was the piece of how do we prepare ourselves, how do we prepare our community for the task that we are going to take on. And then this session is about taking off, right? So as we built that foundational piece, now it's really cultivating those intentional pieces that we have talked about, and the work that we've done with building some of the relationships and things like that. And now we're going to focus on impact. So impact is our process, the process that we have to think through at every level for every piece of the areas of needs that we've identified, so that we can truly deliver a experience that people will remember, and that will continue to cultivate those trusting relationships that we are really focused on. So with that, today I wanted to just give you a quick idea of what we were hoping to cover. So we're going to talk a little bit about the foundations of trust, recap a little bit from the session. So I'll do that in a few minutes. And then we're going to share with you our process and what does that process look like, and how do we create that process so that we get the impact that we want to achieve. And that's really about long-term relationship building, community building, and created shared space that's safe for everybody that's involved. And then we're going to talk about the experience. How do we put all of those different pieces together to create this experience for everyone involved, not just for those that are coming in from our community to get vaccinated or to get information from us, but also for our vaccinators and our partners that are also coming in, and the location that we're at, the people who are facilitating that location. So all of those pieces are the pieces that we put together. And I think that's why we are very unique, because we're very intentional and we think through every piece of that experience before we actually implement it. And then the other piece that I would really love to encourage all of you to do is that today it's an opportunity for us to not only share with you, but we would love to hear from all of you. Because I know some of you have done vaccination clinics and events in your communities. So please feel free to ask questions along the way. Feel free to share. We're going to have some poll questions that we're going to be asking you so that we can do some more sharing together. And our hope is that not only do you take away things that we may be sharing that are valuable to you, but also other participants who are here today that will be sharing their experiences or some of their challenges that you can learn from as well too. So we're excited to be with you and to really create this environment in which we can all share with each other. So starting off, just to recap the last session, one of the pieces that we really focused on in the last session was trust building. Because I think a lot of times when we are in crisis mode, or we're in a situation where we have to do something, we automatically go to the piece of, well, if we create it, people will come. If we created people, we know there's a need, so people will come. And what we have found through our own personal experience is that that's not the case, that it takes a lot of work to get people there, because a lot of times when we have those sessions and we don't do the trust building piece of it, and we don't connect with the people who truly are the influencers to help co-create those safe spaces, that people that come to our sessions or our events that we have may not necessarily be the audience that we are trying to target. And so one of the things that we talked really closely about and was very intentional about in the last session is, how do we create those relationships? How do we take advantage and leverage existing relationships that are within our community already and build on that, so that we're not always recreating the wheel all the time, right? And that's really important. So that's the coming together, figuring out our intentions, what we want to do, what we would like to see in our community, having listening sessions, hearing the needs of the community, and then putting all of that together. So that is the foundational piece that we talked about at the beginning, and the trust piece and the relationship piece. Today, we're going to go into what our process is. So we're going to start out by asking a quick poll of everyone that's here today in our session is, have you hosted a vaccination event before? So you should see the poll question.
And we've had
Okay,
quite a few people take it, so I'll go ahead and share the
awesome.
results. And here are the results. So we've had about almost 90% of the folks joining us today have had a vaccination event, and a couple of folks have not.
Thank you, Mary. And thank all of you for doing the poll. I'm really excited to see that all of you have done a vaccination event before, because that means we're going to do a lot of sharing today, a lot of kind of giving and taking of ideas and experiences and all of that. So please do that. Please share as we are going through the different our process and the different pieces that we are, we've encountered things, barriers that we've had to overcome, all of that. I would encourage you to share your personal experience as well too. And for those of you who have not had an opportunity to host an event yet, or a vaccination clinic yet, please feel free to ask questions of us and of all the other partners here and participants here that have had the opportunity to do a vaccination clinic. Please feel free to ask questions so that we can all collectively provide some thoughts and some feedback to you and maybe some direction. Okay, so thank you, everybody. So what is our process? Our process, as I said before, we keep going back to this foundation of trust, and it's really important why we talk about that, because our audience and the communities that we are really focused on, we became very intentional about who they were. It wasn't we're going to do outreach to everybody, but it was who is it that we really want to focus on. And because of that, we really needed to understand that in those audiences, in those communities, there was a lot of distrust. There was lack of trust between them and other organizations, between municipalities, between leaders from different spaces and things like that. And so we knew that that was a very pivotal piece of our initiative and what we wanted to do. And so we wanted to build relationships, and our whole focus on these clinics was not about just shots in the arm, but it was about community building and relationship building with these audiences that we wanted to focus on. And then we realized too that trust building begins with all of us that were organizing these events. And the Multicultural Coalition, Inc. is comprised of community advocates and community leaders from the communities of color. And they are the ones that sit on our board. They are the ones that are members of this organization. And so we had to find some time to have authentic conversations where we can talk to each other and begin to build trust within ourselves, our organizations, and with each other. And that's really important, because later on, we will face a lot of different challenges, and some of them we'll share with you in a little bit, that we have to overcome collectively, internally with ourselves as the organizers, and then be able to translate that into impact for the greater community and the audience that we are trying to do outreach to. The other piece is that we have to build a team of a space of diversity and inclusion. And that means allowing everyone to have a voice and being able to listen at times and not always talk, right? That's something we had to learn about each other. And then we had to learn about our community as well too. And then last but not least, we had to create this safe space of understanding. And that means that we are open to learning from each other, not only just listening, but learning and shifting our lenses and doing this piece of deconstructing for ourselves, all these privileges we have, implicit and conscious biases we have, and even microaggressions as leaders of color that we were, that we were doing, and we didn't even realize. So those are the things that we had to really come together on internally, and then be able to work through those pieces and externally share our experiences and our understanding and being able to elevate each other and to show that cohesiveness and that, one vision piece to our community so that they can start trusting us, not only as individual organizations, which they've had some trust with, but as an organization, as the Multicultural Coalition, and our goals and objectives there. So when we began this journey, we had lots of choices, right? we had lots of choices, and whenever we encounter something, we have two choices. It's either a crisis or an opportunity. And one of the most important piece is that when we came together, we all had to understand that we were in this for a long-term commitment. And so we wanted to come together to build a stronger, more united community built on trust. And this is something we all had to figure out. We wanted to make sure that people felt like they belong, as belonging is defined by them. And all of us needed to be on the same page, right? And we all agreed that this was the foundation of trust building, not just for now and in the crisis that we found ourselves, but for the future. And this is why it is so critical, because this is what sustainability looks like. It is not a one-time thing where, you know, all of a sudden we're doing this and we're here today, gone tomorrow, right? It's so important that we build sustainability. So what we started to do was to strive to see everything through the lens of those we were serving. We did a lot of listening, and as we heard what they said, we challenged ourselves to do better. Not to just say, oh, well, that's interesting, but to say, how can we address that? How can we deal with that if we need to go over, under? How do we remove those barriers? That was really critical. And we really focused on the equity piece. A lot of times when we do these things, we think that if we have diversity and we have diversity of thought and stuff, we automatically are creating equity, and then that leads to inclusion. But that's not the case, because equity is about intentional pieces that we have to do, that we all have to be accountable for and take action. So through this process, we identify multiple barriers, and we had to figure out how to remove them. One was access to technology. One of the pieces that we really focused on was communication. And I think through a normal lens of who we are in our abilities with technology, we always think, oh, you know, everybody has access to the internet. Everybody should have Wi-Fi. And so those are some of the assumptions that we make sometimes. And what we realize when we listen to the community is that we have people who live in the rural areas that do not have access. We have people that are in our communities, in the cities, and in outer parts of our communities that can't afford internet and all of that. And then we also had to figure out the technology literacy. If they could get on, they didn't know how to do RSVPs. They didn't know how to do certain things. They couldn't retrieve certain information like emails and things like that. So those were the technology pieces that we identified that we really had to work through to really deliver an experience. Then transportation, those were all the other pieces. Transportation and where our locations were, and was it on a bus line, and did we have partners that can transport people? We looked at literacy from the lens of the information, the words that we use on the flyers that we put on there. Those were all the things that we had to consider. And the terminology that we were using, we had to consider safety, because those were some of the barriers that people talked about, was feeling safe, the location and all of that. We also had to deal with fear, and the fear of the unknown, and fear of not knowing what exactly is being shared, or what exactly is being said, or what is part of that messaging piece. What does that really mean? There was also challenges around IDs, and individuals and community members who were coming or wanted to come, but were afraid they were going to be asked for IDs. Pre-registration. We talked a lot about the audience that we were targeting, and what we got from them was that they're not an RSVP audience. And as a result, we can't expect them to pre-register for everything. So we had to figure out how were we going to do this. Cost was another thing as well too. Cost in terms of, you know, what people were thinking they had to pay something, that they were being told they were being charged certain things. We had to allay those fears. We had to put facts on paper for them so they could see it. And then ultimately the language piece, right? And the language piece in terms of their language and what they're comfortable with at the level that they are in their language. And we also had to take into consideration visual pieces as well too. So these were some of the barriers that we identified early on. So the next poll that I want to ask and share with you and get your thoughts on is, what is the biggest barrier that you had to overcome for your vaccination clinic?
It looks like responses are rolling in, so take a quick second and let us know. And for anyone who selected the other category, we'd love it if you could put in the chat what that other barrier is, please. So I'm going to go ahead and close the poll and share the results. All right,
Okay.
so looks like the biggest one, no surprise, is misinformation, and that is followed by mistrust. And then we also have finding vaccinators. We hear that one a lot. Promotion, and then other.
All right, thank you, Mary, and thank you everyone for taking the poll. Misinformation. That was also one of the biggest pieces that we had to overcome in our event planning piece, the process piece, is to be able to correct some of those the misinformation. And just, you know, to give you some ideas on some of the strategies that we used very quickly on the misinformation piece is to really bring in individuals from those communities that we were targeting and really focus on doing outreach to, bringing in individuals they trusted from the health area and things like that, to bring them in so they can answer those questions. So that was a piece that was really important in our vaccination events. We did not expect people to come in to get vaccinated when they were there. We invited them in to ask questions. And that is how we presented ourselves out to the community, is that we were there to give vaccinations where the decision was made to receive vaccinations, but we were also there to provide information. And so that was really critical for us to be able to do. And if some of you want to, in the chat box, share some of your strategies on misinformation and things like that that you've done in the past, that would be wonderful too, so we can capture that for everyone that's participating in here. I'd love for you to be able to share some of your experiences in a little bit, but I want to just keep moving on because, you know, we have some time constraints and I want to kind of cover a couple of different things with you. So as we move through this, one of the things that we really had to shift was really about how do we go from intent to impact? How do we create impact, right? Because we always have the best of intentions, but that doesn't necessarily translate into impact. So there were 3 key pieces, ingredients that we were really focused on. And this is really cool because this is what Lisa kind of drew as we were talking about our process and where we needed to start and all of that. And with all of these pieces of feedback that we're getting from the communities about barriers and all of that, that we just shared with you and you just shared with us some of your barriers, we looked at the 3 kind of pillars to our impact piece, and they were vaccinations. So our partners, our approach, our process, our relationships with our vaccination teams and our vaccinators and vaccine partners, and then community outreach, engagement and resources. So how do we bring everybody in? And then more importantly, all of that overlapped into the experience. So as I said before, what we are doing is not something that is short-term. Our goal is to build relationships that go beyond COVID-19, beyond just the crisis that we are experiencing right now and that we're addressing. And so we have to create this human experience. So our process is combining the pieces of vaccinations, the community piece, into an experience for everybody that is involved. And so what does that human experience look like? We're going to dive deeper into these pieces later with my other colleagues, but just to give you a sense, right? First, we have to identify the community. We have to know our audience. And then we have to plan the kickoff. And what planning the kickoff is really looking at the partners that are coming in and who are they? What are the needs within those communities? And are they the right partners for us? And then we get together and we really look at, okay, what is it that we're going to do? Once we figure that piece out, then we look at vaccination partners. And the vaccination partners are people, individuals that we work with, as well as healthcare teams that are part of our network, as well as individuals or those teams that really want to do more community-based work. And we talk to them. Then we look at volunteers. This is what we're looking at doing. How are we going to do this? We got to get volunteers. And this is where we go to the culturally based grassroots organizations and ask for volunteers from those communities. Because when people come in, they want to see others that look like them. right? This is how we co-create safe spaces. They need to come into a space where they see others that look like them, others that they don't have to explain why they're feeling a certain way, because there's culturally informed lenses that are available there that can answer questions. Then we look at community outreach and how are we going to reach these individuals and what are the strategies there? We look at the flyers and signage that we put out. How simple is it to understand these flyers? Does it create this environment of safety for them to come? Does it give them enough information? If it doesn't, where can they call to get more information? Then we go back to community resources and say, you know, what are the needs in this area and who are our partners there? And then we prepare for the day of the event. There's a lot of pieces of that that you will hear about that we have to do and be intentional about. And after we're done with the event, then we review and improve. So in a glimpse, you know, broader perspective, this is our kind of process and cycle that we go through for every single event that we do. And sometimes we do 2 events in 1 week. So you can imagine how much work it takes to put these events on. So identifying the communities we serve is really important. And as I said that before, it is really understanding who it is that you want to go out and do outreach to. Who is it that the need is there that is not being addressed? And those are really important. And it's bringing in organizations and listening to what they're saying about who they're servicing and listening to those barriers and all of that, right? So we've talked about that and having these initial meetings about who it is that we're serving. And this really drives us with our partners because we've done it where we've brought in snow pants and snow boots because that was a need. We've brought in blankets, we've done diapers, we've done all those different things because we identify the communities we're serving and the needs specific to them. As I say that, I want you to know, though, that all of our events are open to the public as a whole. It is not just one person or one group that we're focused on, but if people come and we put our information out to the community as a whole, and other people from other communities come in, we're open to everyone. Everyone is welcome. And location selection is really important because early on, safety was really critical, and also co-creating that safe space. So one of the things that we really focused on was making sure that we went where people felt comfortable gathering, that there was accessibility, that there was a trust that has already been built in that venue, in that organization, that we didn't have to go and try to build trust and safety in that venue in order to get people there. So that is where we really focused on, were those types of locations where those communities really frequented, they went there, they felt comfortable, and that we didn't have to create that trust piece, right? It was one less piece that we had to worry about. And then we just had to put together an event that was an experience that would be impactful for them when they arrived. So location selection is really important. As I said before, we've used libraries, we've used schools, we've used marketplace and grocery stores and barbershops. We have stayed away from municipal buildings and government-owned buildings to some extent, other than the schools and stuff like that, because we received feedback from, at least from the groups that we were working with and talking to, about the fears around different events that have happened around those types of locations and stuff. So those are things that we want to share with you that we stayed away from. We went to places that were public places that we knew people would go and they felt comfortable. So we did them in different locations at different times to make sure that we were able to help or able to allow everyone to participate or to come and get their questions answered. Lisa?
Thank you, Dr. Pam. Thank you, everyone, for being here today. Just as an FYI, what we're trying to do in today's presentation, Dr. Pam has already started doing, is if you remember the process that we had laid out, and we don't have enough time to go into great detail about each step of the process or each detail, but we were or are working on a workbook that will provide more detail in many of these areas. So we just pulled together or pulled out some areas that have been challenges for us. I saw selecting a vaccinator partner has been a challenge for some of you. I can tell you personally, this has been the bane of my existence in terms of sleepless nights. So I have learned a lot about selecting a vaccinator partner over the past 14 months that we've been doing this. And just to give you the framework, Dr. Pam talked about for us as a grassroots organization and as the coalition, we have done, I think it's more than 55 events in the last 14 months. And I kind of laughed, Dr. Pam, when you said 2 events in 1 week. I looked at Gina, I'm like, I think we've done more than that. I think we've had 4 events in 10 days, sort of thing. And consistently for me, finding a vaccinator partner has been really a big challenge over the past 14 months. But I'll tell you what I've done and what I've learned is I have numerous vaccinator partners to pull from, because given the resources, the waves that we've had of the coronavirus or the COVID, everything, like I've taken everything into consideration. So we have worked with both private healthcare systems and public health across the board, multiple partners, and some additional organizations in terms of vaccinator partners. So I try not to tap one too many times, because I know burnout is real. Staffing shortages are real. So when it comes to planning an event, these are some of the things that I'm thinking of. Okay, I used this organization last, I'm not going to tap them for this one. Or I look at the jurisdiction. Where is this event going to be held? I follow protocol there. So I really have a selection process in my head. But the other really, really important thing is we want to work with partners who understand our approach. And our approach is completely different than what has been done in many cases, perhaps from the public health side of things, perhaps from the private health side of things. So we often say this is a community-led event for the community, by the community. This is really, really important. And as you heard Dr. Pam talk about the barriers, we blow through the barriers. So we want to make sure that we have a partner in place who they're willing to meet with us and talk ahead of time about our approach to make sure we're all on the same page. And then I also want to have a sound understanding of their process as a vaccinator. So I know we've talked about in the past, we worked with a vaccinator and they started working with us at an event, and they started entering in each person who came in into their EHR. And it was backing people up. We had people waiting in line, people waiting 30, 40 minutes. And we're like, we got to stop that. So again, it goes back to having that trusting relationship at the core. All of the organizers have to trust one another, because sometimes we have to have those difficult conversations. So I listed here just some of the questions that are asked in that initial conversation. The second bullet, you'll see, will they allow you to greet people? So in some processes from an organization, they want to be at the front registering people as they come in, and they don't want us anywhere near that. So we had a workaround. We made sure that we had like a greeting table for everyone as they came in, and then we walked them over to registration with the entity that is doing the vaccination. So, and again, a lot of this is not rocket science. It just goes back to that human experience, which if you think about the context, the greater context that we have been in today, many of us have been living in isolation, working like crazy, short staffed. So we're really focused on how do we bring that human connection, that human experience back to what we're doing today for every person that walks in the door. So I have a bullet on here. Does your partner have a friendly and outgoing staff? I can't tell you how many times we've been at events and the vaccinators are not looking people in the eyes. The people at the registration are not looking people in the eyes. Again, it's not finger pointing at anyone. It's just collectively as a community, we have to do better. And then making sure that the teams we're working with, the partners we're working with, are culturally competent. So that means if there's a barrier in place, such as language, that we're addressing that right away, that we have interpreters on site and everybody is comfortable with that. So these are just a few of the things that go through my mind when it comes to us working with vaccination partners. So one of the other things I wanted to address, I know I've seen some questions in the past about like, how do you promote the events that you're doing? How do you make sure that people are in attendance? So you may have heard us say before that when people ask us about how many numbers of people who are coming to our event, we shy away from answering that question. But I will tell you this, we have had events where it's maybe been 5 or fewer people. But in the grand scheme of this, if you look at what we're trying to do, it's building trust. Yes, vaccinations are critically important, and they might be again in the future as things come over. But we want to make sure we're building places of trust. So when it comes to our community outreach, again, we've talked about working with the communities of color, having the right individuals in place to deliver the message. So our community outreach, or if you want to call it promotion of an event, it is not one silver bullet. We are working in multiple ways to make sure that the word gets out. But at the end of the day, we know that that word of mouth is so critically important, and who the messenger is. So these are just some of the more tactical things that we do. Yes, we do the old-fashioned in-person canvassing, and we're going to talk a little bit more about that. Yes, we do media. Yes, we have social media. But again, thinking about the barriers that exist for the community members that we're trying to serve. How can we best reach them? And sometimes it does take multiple channels, multiple ways to reach them. Texting has been hugely impactful for us. And I don't know, Trish, if you wanted to pipe up about texting in our community outreach.
Absolutely. Good afternoon, everyone. And as a community health center partner in this work, we utilize a program called Care Message. And if any of you are familiar with that, it's a program that through our electronic health record, we're able to text out to our patients who have opted in. And I tell you, one of the things that's been so interesting about it is been how we've tailored our language to really reach out to people so they come. At the beginning of our texting, it was COVID-19 vaccination, time, date, and location. And that was great because we needed to get the word out. And when you only have about 160 characters in a text that you're able to do, you have to be very specific in the language that you're using. But over the course of time, we decided that that was more informational, important, but because we were creating this human experience, we wanted to make sure we were inviting people to this event. And changing that up, that it was partnerships inviting you, or we're excited to see you on Saturday for vaccination, or just ways that we're able to make people feel like this was not just a spam or a mass text, but something from a trusted provider like the Community Health Center saying, we'd really love to see you. We were at an event one time and we always ask people, how did you hear about us? And it's a little bit of everything. And many people say, well, I got the text, or someone told me I had to go. And one gentleman came up to me and said, I was invited to this. You guys invited me. Didn't you remember you sent me the text? And when we think that community engagement requires an invitation, and many times our patients and communities, particularly those most marginalized, don't get invited a lot of places. And this was an opportunity for us to really engage and say, welcome. We really want to see you. You are important. Not scoop you up with a net and bring you here because you better get that vaccine, but how can we engage with you and connect? So texting has been a really low cost and really wonderful way to connect with the community.
But like you said, Trish, the wording and how you do it, it's connecting it right back to that human experience, and you are valued. And going back to our outreach, and I want to specifically talk about rural outreach. So recently, Ernesto and I hit the road in rural Calumet County, and we're going to continue to do more and more of this. So literally going door to door with the flyers in hand, with information about health insurance and partnership in hand. So having those conversations firsthand, on the ground, door to door, visiting mega farms, going to mobile home parks, you name it. We had a map specifically planned out, identified ahead of time where we needed to be. And then this is key. Like, we're not just there to drop off materials. We are there to engage. Again, it's an opportunity for me. I was trying out my Spanish and able to have a few conversations, but again, like just engaging with people through this process, putting the heart back in everything we do. One thing I want to make sure that I consider this our secret sauce, and I often say this to Trish, is literally when we have events, we are out there canvassing while the event is taking place. So Trish, I will look to you and to share some of your magic.
Well, and we always look at it that the event isn't from 2 to 5, but the event is an ongoing relationship building, whether it's right now or for future things. And our team is really energized when it comes to the day of, because we know people are coming in, but we also know there are people out there who didn't get our message. And how do we rock the block, walk around, meet with people? Here we are at an African-American barbershop, but next door is a Mexican market. Let's walk in and order a taco, talk to the manager, see if their kitchen staff would be available to come over. And again, not a, hey, come on over, it's here, but wow, we're here. Would you guys be interested? What questions do you have? How do we do that? Walking by a bunch of roofers on lunch break. Guess what, guys? We're having a taco truck. If you need to get vaccinated, it will keep you healthy for the roofing season. Come on in. There's never an opportunity, and some of my favorite have been, and Lisa, I don't know if I shared with you this last time, a couple of strip clubs. They don't really kick in until around 5, 6 in the afternoon. A little bit before that, the Purple Hippo in Oshkosh, there we were knocking on the door saying, ladies, are you interested in staying healthy? But it gave us more than just the COVID angle. It also gave us an opportunity to talk about total health care. Never limit your opportunities for engagement by we should only go to these places. Sometimes it's a quick stop at the gas station on your way to the event to engage. We got a number of people who were on a motorcycle tour over to an event and got vaccinated because we were all getting gas at the same time. It's that convenience, but it's also that opportunity to be like, hey, we're human. Here's an opportunity, no barriers. Let's make it happen. So no time like the present to meet and mingle, but also it's a great way to connect and also hear. And I think from the poll at the beginning, the mistrust and the misinformation, to even have that introductory conversation with people who are hesitant and who might not be like, okay, sure, I'll go and do it today. A lot of times we hear the reasons why they can't. And by hearing why people are not ready to go get vaccinated, helps us also drive our strategies for the future.
And I just wanted to say, Trish, that's wonderful. I want to just chime in a little bit about that piece of outreach and canvassing is so critical. And our preparation for that is to make sure we have medical professionals that are there. So we have tapped, and I know if Lisa and Trish will talk about this later as well too, but we have tapped retired doctors, physicians to come. And so to Trish's point, when they come in, they may not just want to talk about vaccination, but maybe other pieces of health, right? And so we have the medical healthcare professionals there that can address those different pieces as well too. So, when you do these pieces, we try to think broader and bigger than just the vaccination piece itself, but overall wellness and well-being, and making sure that we have the resources on site when they come in to be able to help them head in the right direction, or to give them additional information, or to do follow-up with them.
Right, and utilize Google Maps as your opportunity for good epidemiological outreach, because if you can find where Lupita's Fast Taco is and meet with a pastor there, or talk to people coming off the farms, or mingle at the Purple Hippo, you know that they're on the map. It can help you be efficient with where you need to go, but also you may not see other places along the way because you might be like, I've got to get to this place. But if you pull out a good map and see where it is, it just gives you an opportunity to really get out there and understand the broader community.
Thank you, Trish and Dr. Pam. So with that, we do have the next poll about what is your most effective outreach strategy. So we have in-person canvassing, social media, texting, community influencer, and other, that vague category.
We've had a few folks take the poll so far. If you haven't had a chance yet to take it, take a quick second and let us know what your most effective outreach strategy was. And if you select other, we would love to have you chat what that other effective strategy is so that we can share it with others. All right, I'm going to go ahead and close the poll. And it looks like it's pretty close between social media and in-person canvassing. And then we also have community influencer, and we've had one person do texting, and then we have another one that we, someone selected other. So we'd love to hear what that other strategy was.
And I just saw other in the box, and Lisa and Trish, and Jade, thank you for sharing a really good DJ and food, which, just so you know, we've had in our events. So thank you for sharing that.
So we will move forward. Thank you again for everyone taking part of that poll. So again, for us, when it comes to outreach, we are doing all of these things. We have a massive process when it comes to outreach, but I will vote for in-person canvassing, which has been hugely, hugely effective for us, again, about building trust and engaging. So one of the other things that we do when we plan and we go into our events, again, community-led vaccination events, is we partner with a number of resources. I think, and partners, I think the last time I saw in the work we've been doing, we have partnered with probably more than 65, 70 community organizations, nonprofits, minority-owned businesses, you name it. But again, when we look at our partners, who our resources are that we want to bring to the events, we have to make sure that we have the right partners in place working with us. So I put, if you see the first bullet point, we're very, very intentional about, we don't want to work with a partner if you're just here to check the box that you did outreach. Like, our expectations are, if you're going to be at our event, you are engaging, you are conducting outreach, you are serving the community, and you're talking, you're listening. So again, this is really, really important to us. There is nothing worse. For example, when I walk into one of our events or somebody else's event and everybody's standing behind a table, that's not what this is. I view the table as another barrier in place. So this is really, really important, that what our mission and vision is, that it aligns with those other community resources. And we have to have the right people in place. Again, super important. And then just wanted to focus on this. You can see this picture. This is Trish actually engaging with a little boy. We had a little, I know I'm not supposed to call it Plinko. We call it the prize drop game. Just one way that we engage with families. We get a lot of families who attend our events. And I love, you can kind of see in the background, we have, and that's actually a reflection of the mirror. This was a hip hop health fair at a locally owned fitness gym. And it was just wonderful. We were focused on reaching the Black community. I'd say we had about 95% of the Black community who showed up that day showed up. And we just make sure every event we're at that we're providing those warm connections. We're not pointing and saying, go talk to that person, go call that person. I have never seen a team like our team make sure that the follow-up is done either on site or quickly thereafter. Nobody goes left not being heard, not being taken care of. Again, we have so many community partners on site. And one other thing I want to add is, because we've all experienced the course of the last couple of years, you know, we have surges in the virus and then they go down. I just want you guys to know, from a safety perspective, we flex as well. Early this year, I think it was, we limited the number of people on site. We limited the number of resources. So we're constantly flexing and focused on making sure that people are safe. Again, this is just a couple of other examples. You can see a woman is sitting here. We had, and Trish, I'll let you pop in with this gentleman who offered to volunteer once he saw that we were doing this event at the Hip Hop Health Fair.
This was one of these moments that was really serendipitous because we had texted out to all our patient population about this hip hop event. And the gentleman who's behind the table happened to be part of the partnership family and reached back out to us and said, I really want to give back. I'm vaccinated, I'm good, but I'm a caricature artist. And could I come and attend and draw pictures of people free of charge because I really believe in what you're doing? And what an amazing opportunity to have someone who has been served by an organization come back and be really excited about getting involved. So not only did he come back as a small business owner, draw his pictures, but also connected up with a number of people and then asked if he could be a community consumer board member at Partnership. So there were so many opportunities here that just connected. Again, vaccination was one point, but let's talk about community engagement and community building, and particularly for a man to respond to something to say, I'm inspired by this. How can I get involved? And when we struggle as a community and as a nation these days with really that feeling of isolation and not connecting as people, that really was inspirational to all of us, that here was somebody who said, I can't wait to get involved. Thank you for giving me the opportunity to come forward.
And people were
Lisa-
ecstatic. Yeah, go ahead.
I just wanted to say, on the note of what you're saying and Trish is saying, one of the point that I want to make is that part of the reason why that partnership piece, we vet that so closely, is because we have to think about that when we refer people to those partners or we introduce those partners to them, we are transferring trust. And that is something that we don't think about sometimes, is that we're just handing them off, even if it's a warm handoff, but it's really, we're taking our trust and we're transferring it to that partner. So that's why we vet partners so closely.
It's extremely important, that chain of trust. Just wanted to point out in this other picture, you can see a couple of boys reading books. One of the biggest pluses that we integrated into our observation time is we have a book cart often at our events giving away books. And when I looked over and saw these two young men, two young boys reading their books, it was like just the best thing ever. And so we've continued to do that as much as possible. Literacy is a huge part of our events. So we have often mentioned throughout this presentation about the human experience. I want to talk just a little bit about like the day of the event in terms of more of that human experience. So we just make sure every person that walks in our door walks out leaving a little bit better about their day, about their community, about their fellow person who maybe reached out and talked to them. We have had so many interactions. Many homeless people show up at our events and attend. We have had people with mental illness. Like, there's so many stories to share that are so powerful about the impact that we are making. So, and of course, we want community members to share with others as well their positive experience and how they felt when they left. Again, this isn't rocket science, but these are just some of the things that we listed that we make sure, like that people are being greeted at the door, that eye contact is being made. I will tell you, not too long ago, we had an event where I could feel the person's irritation as soon as they walked in the door for a vaccination, that they did not want to be there with us. And then it took about 15, 20 minutes to get them registered. And that was taking too long. And I could tell he was getting more impatient. So how can we address that right on the spot? How can we make sure that he feels good about his decision to be vaccinated? So eye contact, that engagement, obviously having bilingual people on hand, the member of the communities that we're serving, making sure that they're there as well with us and serving as a point of contact. I mentioned not standing behind a table, stand next to it, have a conversation with somebody without a barrier in place. A big one, it seems like a little thing, but it's a big one. Walk with people. They are on a journey. You are there with them on this journey. One other thing, I just want to make sure that I get across, and this has been an amazing experience. Early on, a public health department that we worked with, they shared with us that they do a huddle before their events, and they would gather the vaccinators together and go over the flow of event, the process, etc. So we took that idea and we blew it up. So we gather all the volunteers, everyone, the community partners, and we gather around and we have our huddle. And it's not meant to be like, here are the bathrooms. Of course, we integrate that process into this. It's meant to be an engagement tool, and it's meant to make sure everybody feels like they have a part in a very special event. And I cannot tell you how many times we have had community partners, vaccinators come up to us saying, I've never been to an event like this where there's vaccination. So again, we're building enthusiasm, we're building trust, we're building engagement with the organizers ourselves. And of course, we say thank you and acknowledge our partners over and over again. We want to make sure that not just the attendees feel good leaving that day, we want to make sure that the organizers feel great leaving that day as well. Trish, did you want to take off from here?
Absolutely, because after we kick off our huddle, and there's always an element of logistics that's built into that, and then a little bit of an altar call, that this is really the opportunity to talk about transformation in the community and inspire people a bit, or recognize the struggles that we've been on. We also want to make sure that everyone that's a participant with us really feels that the power of the work that's going on. So whether it's 5 people who show up or 107 that come, it's really all about the work and all about the spirit of the community. So that's something we really set together. And I think that's been a really important part of the work, because once people are connected in not only that human level, but in that philosophical, but that like we really are all in this together, it changes it up. So when we talk about the mingle, and this is, really, I think that in some ways, secret sauce that Lisa talks about is how best to really connect with people and how to utilize some of the natural blocks of a vaccination event to do that type of work. And we really find that observation time, because people do need to sit for 15 minutes or for 30 minutes, depending, and be observed. So as we're there, we really sort of roll out the red carpet in a lot of different ways. We have water bottles. We have the rolling book cart. We can come up and just say, could I get you something? How is it going? How does your arm feel? What's going on today? It's not a lot of pre-packaged conversation, but again, it's really that human touch of how can we just greet you and meet you and listen and engage. And one of the things that we started early on in doing was having people fill out a little questionnaire about how can we help? Because many times if you say or ask someone, so how's it going? They'll say, okay. The conversation stops and starts there. But we have a little form that says, how can we help? Do you have any concerns about your health or about your teeth, or concerns about your mental health or medical bills or other little things? Little like 5-question survey. People are able to fill this out, and then we as the community health center team, along with our community partners, can follow back up with people. We particularly ask about, do you need health insurance? Are you concerned about that? Because we know that that's another piece, particularly within a public health emergency, that if people aren't getting care, they're not getting their medication, and if they're challenged with health insurance, we can really help with that piece. So as we do that, that's a conversation starter, not an inquisition, but really an opportunity for us to connect and then offer. There are many times, and I look at this one right here, where there were people who were older adults who came in who didn't really need anything, but one gentleman said to me, my son is living at home with us. He lost his job. He was a chef. He doesn't have health insurance. How can we connect? Can he come to this vaccination clinic? So as we start really figuring out ways to connect with people, what are the issues that COVID has really impacted, and where are people there? And there's a lot to talk about in that piece and in that place. So then we follow up the next week, we keep a database going and really try to make sure that we do those wraparound services. If someone's asking for something or needing information, we just don't want to ask and then not answer. So that's a really important part of making people feel as though they were listened to and their needs were at least addressed or recognized. Not that we can fix everything. There aren't magic wands, but many times people come in with many other things: food insecurity, housing insecurity, challenges with employment, needing services for children that have been at home for the past couple of years and they haven't gotten connected with a Birth to 5 program, women worrying about preventive health care. And that gives us an opportunity to really start again working through that transformative experience about health and wellness in the community. So as we're talking with people and connecting, making sure, as Lisa and Dr. Pam were talking about, that partner experience, the people around the table are really engaged in this. What else do they need? How can we help them? How can we help them move from behind the table to in front of the table and really engage them in the work that we're doing? And a lot of times there are new people coming to this work and they're not familiar, or they may not know how to start that conversation or take that step out from behind the table and meet with somebody. So it's really, again, that human connection, but also that appreciation. Thank you so much for coming. What inspires you about this work, or who can I introduce you to? We are constantly doing that. Have you met, do you know this person over here? It's in a lot of ways sort of a COVID cocktail party experience, for lack of a better phrase, but always trying to get people to mingle and really meet as people. But the group that's always been outside of this for so long have been the vaccinators in our experience. Many times our vaccinators have felt like they're just there to staff the event or just give the shot in the arm, or, they're just kind of showing up to get a job done. And what we've really found, that as we connect with them, realizing that the challenges that they've had, particularly in that role, because our role as community organizers and advocates and planners of this event is very different than the person sitting there putting the shot in the arm. And they've also faced a lot of barriers and a lot of challenges and carry the weight of this work that, well, I'm sitting in this chair and maybe I didn't get a lot of people vaccinated, or what is this really all about? And the isolation that they've felt as individuals doing this work, and particularly when there's been, community angst around vaccination, or people are very hesitant or very anti-vax, people who are the vaccinators really feel that. So we really wanted to make sure from the beginning they walk in that not only are they welcome, but they are part of the team. And I know we say that thank you piece should never be underestimated, but we have also resourced them in some ways. Many times the vaccinators come with their little suitcase of stuff, but we found that there are other things that can really help sort of sweeten their work. Many times children and adults are worried about getting the shot. They're scared. We bring weighted stuffed animals. So people, and we say people, not just children, can have those weighted stuffed animals on their laps, have something to hold. Make sure the vaccinators are there, not only with fun Band-Aids, but other little gizmos that they can give out. And just continue to circle through that vaccine area to make sure that they are really recognizing that we value them. They're part of something special, and the people who are sitting in front of them are there because the vaccinator is able to provide them with something. One of our vaccinators at an event said this, and I thought this was so powerful. Usually we come in and nobody says hi to us. We arrive and there's no one to greet us, show us around. I haven't ever worked at an event like this. I wish all clinics could be like this one. We feel welcome. And when we think about that spirit that's passed on to someone doing a task, that's the human spirit, that's the possibility. That's, again, a piece of the transformation that ends up happening to bring in yet another group. Many times the vaccinators are coming from municipal organizations or contracted services or hospital systems, and they've already worked their 50-hour week and they're doing this as a volunteer or coming in to do something extra. and to make sure that we know that they walk away feeling not only valued, but appreciated and part of the solution to really transforming their community. It moves this from just checking the box and putting it in the immunization registry to being part of something greater, something good, something really powerful. So as we think about this work and think about the human experience, we would love to know what can everybody else do to continue to improve this? Where can we learn? What are opportunities? So in the poll, what's one thing you could do to improve the human experience at any of the events that you've done? So take a moment, please. And if you could answer that question, that would be wonderful.
We've had a few people take the poll. We'll wait and see if we can get a few more folks to respond. And so far, we haven't had anyone select other, but if you do have some other strategies, feel free to put those in the chat so we can learn from you. I'm going to go ahead and close out the poll. So it looks like our most popular, with about 2/3, is engage with community members, and that's followed by process improvement and engage with partners.
And engaging with the community partners, and I think we feel the same way, because again, we can't make the assumption that all community members and community partners are the same. We have to continue to learn how best to work with them and what strengths and what resilience they bring to the table, and how we can continue to work with them and connect. So I completely agree. If I did the poll, I would definitely say, as much as we engage, I would love to continue to find ways to continue to engage with community members and really learn not only evidence-based best practices, but really, again, what is that human experience that we're able to learn from, and how is it different working with a 21-year-old new mom opposed to a 65-year-old first-time vaccinated gentleman who hadn't left his home in 2 years due to fear. So as we think about ways, what are the different strategies and how do we really best make it effective? And when we think about what's effective, we really then say, and we're asked all the time, so were you successful? Did you make a difference? How do you define your success? And is it numerical? Is it subjective? Is it objective? What is the success that when you walk away from an event, you really are able to not only add to the flavor of the grant report that you're writing, but to the human experience piece, and then also reporting back to the community? So we've started to really look at this in a number of different ways and ask ourselves, what is our definition of success? So we know that if we wanted to be very numerical and financially driven as good stewards of this work, the average cost of someone who's unvaccinated who lands in the hospital, and this is a lowball cost, is $20,000. And we know that our country has spent billions of dollars on unvaccinated people in the hospital. How do we take this and switch it to say, okay, we recognize that there's a cost deficiency in not having people vaccinated, to what is the power of changing lives with vaccination rates? What is the impact, not only from a financial analysis, but from a community possibilities analysis? We know when people are healthy, particularly people in communities who have been not always at the table, disengaged, not involved in health equity work, not being healthy due to the disparities of COVID and generational poverty and other challenges, has left them powerless. Vaccination is an opportunity to step forward and join in and be powerful, because you then are taking a step forward in being healthy. And when we looked at our county, and for those who are outside of this, I know some of these words, Outagamie is a tough one to say. Outagamie, Winnebago, and Calumet are the 3 counties in the area that we've been doing the most work. And this was just a quick snapshot that we got about the amount, the percentages of vaccination rates. And one of the things that really, against our state data, that's really compelling is we can see that within the communities of color, we have made an impact, not just in vaccination, but an impact in reaching these communities to bring them to the table. And looking at these rates, knowing that one vaccinated mom, dad, grandma, grandpa, friend really allows us to say, this is the community moving forward in an equitable and a powerful way because they are taking care of their health and we're providing opportunities to engage and do that. The other piece, as we time it up with great data and looking at that and checking the boxes for grants, are really the stories that emerge from this, the people who come to the table. And as we look at these opportunities, these are the pieces that really stay with us, that really last, that connect us to the work. Connecting people experiencing homelessness to housing resources, providing that stability of knowing that one reason they might have come in was because there was a food truck out front and they left vaccinated, but most importantly, they connected potentially with a pastor who was there. They were able to get some hygiene supplies. A young mom with 6 kids who really, particularly in this economy, can't provide toothbrushes and toothpaste for her kids. We want to make sure that we're addressing some of those basic human needs, those elements of dignity that people are able to then say, I'm trying to do the best for my family, and we're really connecting with partners who can help us do that. We've really gotten into a place where we talk about coverage to care and COVID vaccinations and really signing families up for whether it's Medicaid, knowing that they're eligible still under the public health emergency, or looking at options through the federal marketplace because so many people have lost jobs or have been impacted with changes in income, making sure we're really talking about that piece. And if people are ineligible for health insurance, linking them to services on sliding fee scale programs at our community health center. Providing opportunities to be barrier-free and really feel like that welcome to our home. Everyone is welcome here, regardless of any barrier that they might have. Helping people go through the fear of needles, really helping a young dad who wanted to be so desperately with his newborn, but couldn't be because he hadn't been vaccinated yet. Helping him work through that behavioral health piece, that fear, but ultimately supporting him as a dad and wanting to do the best with his family. Providing vaccination for a husband and wife who had been really ready to hop in their car and drive to Ohio, which is not close to Wisconsin, because the mom was really afraid that somebody might ask her for ID, and she was here without ID. Also, someone struggling with multiple complex health issues. And we were able to say, we're not only here for you for the vaccine, but let us help you connect with the other things that you might have. There's always something to learn. We look at this as a living PDSA cycle. Plan, do, study, act, and continue to refine. Many of our lessons learned are very practical. Always have interpreters on site. That's just one of our basic premises. If we're working with people who are coming from languages that we're not able to have warm bodies there, making sure we have language lines and opportunities so people feel as though they are being respected and heard, and have a backup plan and a plan for that backup plan. And then yet again, another backup plan, because you never quite know whether it's weather, whether it's changes, whether it's protesters in front of a vaccine clinic or a day that the food pantry is coming in. There's so many different things that we really need to always be attentive to. Also, and we had mentioned food before, the other lesson learned, and it's lunchtime, so we can talk about this. Always make sure that when we're providing things, that it's not just food or things that we think people need, it's really things that are culturally relevant and valued in that community. We have had Hmong egg rolls, we have tacos, we've had meat pies, we've had all sorts of things that people can, not only from that culture, enjoy and feel like, wow, they understood me, but people from other groups can, again, pollinate cross-culturally and really connect. Making sure safety is the utmost importance, particularly in a world today where there is so much uncertainty with safety. Making sure people know a phrase that Lisa started off on day one, and we hear it in my head. I hear it in my head all the time. If you see something, say something. Really making sure that we're always cognizant that safety, not only emotional safety, but physical safety, is a priority. and being ready at registration. Nothing worse than having people already lining up, kind of tapping their fingers saying, okay, let's get this going. Why are you guys taking so long? Being ready and being welcoming. And then always do that final walkthrough, looking under the tables, moving things around. Are the chairs there? Do we have wipes? Where is the trash can? All of that party planning logistics, but then also that final walkthrough is an emotional scan of how is everybody doing? Is everybody ready for this? Are we connected as people to really run this together? So I think those are some of the things that when we walk away from this, we really feel like on a practical level, we're ready, but on a philosophical level, we're really there. We do know that as we do this work, it's not a one and done. It's not just a come in and get the shot. This relationship building, this trust building, this community development piece, and I think Lisa puts it really well as we've been talking about this. It's taken hundreds of years of history to get where we are today. And we really need to look at this, that if this community relationship building, breaking down of barriers is not just a one and done, but this is ongoing generational work. That building trust now is building trust on an ongoing basis. And this might be COVID right now, and hopefully not forever, but it allows us to position ourselves as a community and as trusted partners to really move forward together. And the time that it takes to organize as a community is an investment. Never underestimate the importance of that meeting that went over, or that conversation that kept going, or that possibility of really thanking someone for not only coming to the event, but getting vaccinated, for caring for their family, and really feeling as though they're connected to something bigger. This work is powerful stuff. We talk about this all the time, that this is about transformation. It's about building relationships, and it's about really coming together as a community. And one of the things that always sticks in my head was a quote that John F. Kennedy once said, and as an ex-Peace Corps volunteer, it really resonates with me. When he was sending the first group of Peace Corps volunteers out into sort of the unknown, and for much of this work, when COVID hit, this was the unknown. And he stood on the steps of University of Michigan on a really blustery, cold day, and he said to the group, each of you is a light sent out into darkness. Your light may not shine in 10 years, 100 years, or even 1,000 years. But let us begin today to defeat that darkness. And when we look at this work, and the work that we're doing at the grassroots community level, the work that every one of you is doing around the country, this is the light that sets us on fire to continue to move forward and defeat what we don't know, defeat what we do know that needs to change, and be part of something that's so powerful, so transformative, and something that's really going to make a lasting difference in our community, in our nation, and in our world. So thank you so much for the opportunity to share this. I know we were all sort of rushing through some of this, and hopefully we have a little bit of opportunity still for some comments or questions, and a thank you to all of you for everything that you've all done up until this point.
You're here. Thank you, Trish, Lisa, Dr. Pam. So much great information. Obviously, we could go on and on. 90 minutes is probably not enough for all of this time, but we do have 10 minutes for some open discussion and Q&A. I know some questions did come through on the chat that our facilitators have been answering as we've gone along, but we might revisit some of those or chat new ones as they come up. We are going to ask, as we're doing this Q&A and open discussion, for you to complete the very last poll, which is a satisfaction poll for us as group learning managers that we do for all of our events. So would love for you to complete that before any of you need to depart. Remember, the group of facilitators will be on for an additional 15 minutes after the workshop ends as well. And the final thing I'll say is, it came up once or twice during the discussion, but we will have a product coming out of these two workshops that is like a checklist workbook. I'm not sure exactly what we're going to call it yet. It's still in draft form. We're drafting it right now, but it will compile a lot of the information that you've heard, and it will be available to you We'll make sure that you directly as workshop attendees get access to it, but we'll also be sharing it broadly through our learning community channels. And it will be ready a little bit later in the summer. Our target date for that is in July. So not right away. We need a little bit of time to finalize it, but hopefully within 4 weeks or so, we'll be able to be sending that out to you. All right, so any questions that have come up? I see several new chats. So anyone who has been looking through them wants to share a question, or if folks want to come off, there's not tons of us on, so you can also come off mute and speak your question, because we're a pretty small group here.
I know I'll just reference, I know that there were some questions about rural outreach earlier too, some challenges in that area. Is there anything that anyone wants to specifically ask or get some more feedback or ideas on?
Lisa, I think one of the questions that came up was specifically about, how on earth would you do canvassing in a rural area when people don't live necessarily door to door? I live in a very densely packed neighborhood and you could hit 500 people in like an hour. But in a rural area, that doesn't happen. So how do you deal with that?
Oh, yes, I'll tell you, and I'm just speaking about our most recent endeavor out in Calumet County, which is really rural. If you are familiar at all with this county, in particular, it has mega farms, it has small farms, it has manufacturing, everything really like spread out. I think there was a previous photo of myself and Ernie out in the middle of nowhere. So we just had my car and we would drive miles to go to a manufacturing place of business. We would go to the mega farms, and interestingly enough, I was actually a little hesitant about going out to the mega farms because one, I thought that they were just going to kick us off. Two, when we went out to the mega farms, a lot of them had signage about, like you need to call this number and check in. We went ahead and went there on premises anyway. And it was great because we would run into some of the employees and had that firsthand interaction. So I'm not going to say we like hit 50 places in 6-7 hours or however long we were out there. It was tedious. Now, as we mentioned, we look places up on a Google map. We're trying to identify where do you think we should go. One of the places, I'm not even sure if this one was on the map, was a mobile home park. So it was a little bit more densely populated. So we went door to door. So that was an opportunity. And then in this particular county, there is Lupitas, there is the marketplace that is frequented, known as a community gathering place because it's just not a market. It's also a restaurant. We make sure that we have lunch there. We're interacting with a community leader right there at the restaurant, hanging out, wanted to talk, we talked. So again, it's just like taking the time. It's not, and I think that this is really, really challenging for us today because all of us have access to technology. Here we are on a Zoom call. We know how to push the right buttons. We know how to get our message out. And this is really about taking a step back and thinking differently and looking at, again, through the lens of those we're serving and what's important, and then readjusting and again, taking the time. This is not a fast silver bullet to any of this, but taking the time.
Yeah, and Lisa, I just wanted to add to that. I think one of the pieces that is really critical is knowing who your community influencers are, because they can really point you in the direction of where people congregate and people come together. And they may not be spaces that you're familiar with or that you know about because you're not entrenched in that community. And so, we've talked about going to places where they play soccer, where they do different things at certain times that people have said, go here, just because they all get together here at this point, or they do this at this time. And so you rely on your community influencers. And also what I put into the chat box in response to that question was also about leveraging that trust that your community influencer has by bringing them with you and having them come with you. So they give you that credibility of the fact that you are there to truly help. And we have to understand that when we go into these historically marginalized and oppressed communities, is that people don't trust easily because they have trusted in the past and they have learned their lesson, because there's been people who have come around who've not had the right intentions, right? And so there's a lot of distrust. And so when you connect with those community influencers and they trust you, they will share with you where people are, and you can go there, and they can also then, transfer that trust that they have to you from their people and their community. So that's something that is really important. Sometimes we don't think about that. And influencers are not necessarily people with big titles that have big positions. Okay. I want you to understand the difference between status and influencers. Status can be someone with a big title, could be a doctor, could be this, could be that, whatever the case may be. But influencers may be the guy that works at one of the companies, but everybody knows who he is and everybody listens to him. And when you need something, you can go to him and he can get the message to people and people show up. You begin to understand who the influencers are by making sure that you get engaged in that community and listen to who people talk about and say, oh, this person told me this, or that person told me. You begin to understand who the influencers are. And they may not have a title. They may not have an education. They may not be engaged in the community organizing piece, but they have influence and they can help you, and they can transfer their trust that they've built with their community to you so that you can do what you need to do to help that community be successful.
And I think too, along with the outreach piece, particularly in rural areas, who else is going out and about? How can you team up with them? Because it just isn't always one of us going on behalf of the vaccine piece, but there's also opportunities to, kind of like I always say, what's in your trunk? Do you have a little bag of other stuff that you're bringing out there that we can add this in to what you're doing? So vaccination doesn't stand alone, or birth to 3, or food insecurity. They're not all these little silos, but if you find ways within your partner groups who are already engaging with different members of the community, how do we expand their ability to connect with people and bring our messages, whatever those messages might be, to those groups, and really bring it in a way that really is maximizing community resources, but also building partnerships as we're going.
I just want to interject one thing, because I think that we often, Dr. Pam, Trish, and I, we have mentioned, but really going back to the community organizers and the trust that we have amongst ourselves. If I did not trust Dr. Pam and Trish and the rest of our group implicitly, nor if they did not trust me, this whole thing would fall apart.
Mm-hmm.
So I want to make sure that, like, just so you all know, on this meeting call, Dr. Pam, Trish, and I did not work together, barely knew one another before we started this work. And Trish, you mentioned something too about the social COVID hour or something like that, the COVID cocktail hour, that this organizing and all of our shared experiences and being on site as community organizers together has just allowed us this opportunity to grow and share an experience together and to build that trust, because we rely on each other implicitly for a gazillion things to get done. And if we don't have that trust, again, at the core of this community organizing, the wheels fall off the bus.
Yes, Lisa, and that's really important. I mentioned that at the beginning when we started about how trust needs to start internally with the organizers, people coming together and trusting each other and being able to share our concerns in our, and for the other members to be able to be open to hearing that and to be open to taking feedback, right? So that's really important. I just want to answer the question, or Rose made a comment about, organizing a soccer thing and then doing vaccination. So Rose, we did something similar to that, but we didn't actually organize the soccer piece or the tournament piece, but we have festivals within in the state of Wisconsin. We have festivals that are state festivals and national festivals that are in our backyard, which is in Oshkosh. And so they have events that they are coordinated by the local organizations, culturally based organizations, and people from all over the nation come, from those communities that come, and we did a pop-up clinic there at one of those events It was, I think, Labor Day that we did that. It was a Labor Day national event that we did that, and people walk through, and we had people there to answer questions. We had vaccinators there to do vaccinations if people wanted to, and we did. We got a lot of people vaccinated, and there were a lot of people walking through and saying, "When's the booster coming?" And all of that. So then we began to understand what's the next level that we have to now focus on in terms of outreach and information. Is people are interested in boosters now and all of that. So that is a great opportunity for you to maybe engage with existing events that are already there, as opposed to creating your own, because that in and of itself is another process, is to create those pieces. But if there's existing celebrations or existing sports events that communities are familiar with, they trust, they've gone to these for years and years and years, like the one in Oshkosh Labor Day, that's been happening for about 20 plus years now, almost 30 years now, that event. So people are very familiar with that. They're very comfortable with it. And so when they come, they know that people that are there are people who really do want to connect, people who really do care. That's why they're there at the event. And the sponsors are they vet all of the people that are coming in. So it's not just anybody off the streets can come into those events. So that's the other piece, is to develop relationships with those organizers of those events. So they understand what your intentions are. So they see the value, they see what you're bringing to the community, why you're doing what you're doing, and to get into those spaces so that you can have more access to provide information, to share, and then to vaccinate if people choose to.
Thank you, Dr. Pam. That is great to know, because my organization has a youth group that they are going to be organizing those kind of tournaments. So that's why I was thinking if that would not be a good thing to combine kind of having that clinic around when they are playing. So good to know.
Yeah, you bring up a good point. So there's kind of two approaches. One, there might be a larger event that we integrate with, or two, we do our standalone event where we go in and it's just focused on this community-led vaccination event. And then I will say that we have been asked by some community events to be a part of their community event, and based on who we are serving and our mission and vision, that we have said no, that it did not make sense. So again, we're very, very focused as the Multicultural Coalition, focused on communities of color.
Rosa, I love what you're saying about having, soccer and youth events and other types of things. It gives you a really great opportunity then to tailor your messaging in a way that ties in with that event. We did a really incredible student-led vaccination clinic with some students who are at a local high school, and they really helped guide the messaging to reach out to, older students and their families, and really make it their own. So I'd encourage you to find ways to, as you're working with that group, for them to come up with the why. Why is it important to do this? What's this all about? Great to have the logistics, COVID vaccination, this time and date, the things you need, but really to have that, again, message from those influencers. Are they the players? Are they the students themselves or their families who can really come out and be part of your positive messaging, so people really can start to normalize this and feel that they're supported and connected to other people who believe in this as well.
Thank
Thank
you.
you.
And I just want to say something really quick in response to Rose. Rose, so along the same line of what you're thinking, there is, so one of the groups that's part of the Multicultural Coalition is Northeast Wisconsin Hmong Professionals, new Hmong professionals, and they are doing a summer volleyball camp for all of for Hmong students, and so their final event is going to be like a volleyball tournament where all their families are invited and relatives are invited. And we are going to do a pop-up clinic at that final event, for that final event. So that, along with kind of what you were saying about, the groups developing your events and then having a clinic as part of that, right? So we are going to do that this summer with a group, with one of our, organizations, and they are hosting a volleyball summer camp for Hmong students specifically, with Hmong coaches and all of that. And then at the last day, we're going to do a tournament, and then we're going to bring in MCI to help with the vaccination. So we will have a vaccination clinic or, a component there to answer questions, to vaccinate, because right now what we're finding is that with the new direction from the CDC on 5 to 11-year-olds being eligible for boosters, we have not had an opportunity to go to the schools to do that. And we kind of want, part of what we're doing is timing and trying to get some of these things done before school starts again. So we want to kind of combine our efforts in that respect for that, to address the boosters for the 5 to 11 in a environment that we help to co-create around a sports piece, and then a family-driven piece as well too. So lots of different goals and objectives as to why we wanted to do it there. But to your point and what you're trying to do, I think that is really something that you can kind of build on.
Carolina, I wanted to make sure you had a chance. I saw your hand up. Thank you for your patience.
Oh, of course. Yes, lots of questions, but two main questions for now. I know you all mentioned earlier just like health literacy, a focus on that. And so just a question regarding if you have certain accessibility standards or health literacy frameworks that you all use in your event promotion for your flyers, any informational infographics that you're passing out to community members. And secondly, you all mentioned cultural competency, ensuring that that is maintained among your staff members, but also with the different CBOs that you're partnering with. Is there a certain training that you all followed or that you all created, or what are maybe like core competencies that you're looking for, or how are you asking that question of those partner organizations?
So first, I'm gonna focus on the first part of your question, like
Sure.
standards of accessibility when it comes to literacy. Is that correct?
Yes, ma'am.
Yeah, and I will make sure that there are details of that in our, I'm gonna call it a blueprint.
Sure.
So we're always looking at the words we choose, the word selection, because then we know we are gonna be translating. So that's one variable. We're looking at the visuals are hugely important. Font size, there's quite a few other things. Like we want to make sure that it is understood what that information is about, and we're looking at it through the eyes of the communities we're serving. And then Trish, I don't know if you wanted to add a couple other things from the partnership side as well.
One of the things that, yeah, definitely, and it's a great question, Carolina, thank you. Particularly from the health literacy standpoint, we always want to make sure we're utilizing a trauma-informed lens. So when we talk about our get to know you form, back in the day, it was, have you been to the doctor? Sort of like that. And then it was changed around to, do you have concerns about your health? So we were allowing, and maybe that's not the right word, we were really helping the person filling out the form or doing or interacting with any of our materials to be the one in charge of their information and start with where they were at. So that's always been our perspective of what's going to resonate not only with the community, but the individual who's going to interact with any piece of material that we're creating, and making sure that trauma-informed lens is there, the literacy lens, the cultural lens. We go through a lot of different renditions. And then also we're beginning to develop materials too that are much more visual. So we're really moving away from even words to now looking at images and in how we talk about vaccination and what's going to be happening at the event. So we're making sure that people who are, not reading in their own language or any language, or, just engage better as visual learners, we're taking that into consideration.
Yeah, and I just want to add to that the images that we put on our flyers are really critical as well too. I think early on when we started, we looked at who we're targeting, who we're doing the outreach to, how is that represented in our flyers. And then we evolved, we started using stock photos and stuff to try to represent that. But as we did more events and stuff, we actually asked people if we could take pictures of them and if they would be willing and okay for us to use their picture in some of the flyers that we're using, that we're putting out to the community, and getting their permission to do that. So it now becomes, the pictures that you see are not pictures from the internet or other communities or whatever. It's from our community, the people that are actually getting vaccinated through our community, in our community. And so those are powerful pictures, because people will see them and say, oh, I know that person, or I know that individual, or I know that child, or whatever it is. They know that. And so that's how we start to connect with, this isn't just about something that we're doing that's outside of our community, and these aren't the people that are just outside of our community or something that's stuck, but these are our community members. I mean, these are who our community members are. And so that's how you continue to connect.
Early on, we did a promotion with our primary care providers, who are a very multicultural group. Instead of saying, you need to get vaccinated or vaccinate today, we had pictures of them, and we designed this in conjunction with this team of "We trust the vaccine." We did that in multiple languages. So it was the picture of the provider and their care team saying one basic thing: we trust this. And if we can trust it, maybe you can too, with that implied. So really making sure that our language is, again, supporting that trust building at all levels, whether it's in a clinical setting, whether it's in a community setting, or an individual one-to-one, making sure that those visual representations are familiar people. And again, we're always building it back to that trust and that confidence in the work that we're doing.
Then I want to make sure, Carolina, we address cultural competency. So I just want to set the table a little bit with, this is the focus of Dr. Pam as a community leader, a community member. For me personally, it's huge for this community to we need to shift as a community. So one of the ways we can do that is through cultural competency, because what we're trying to achieve is got to be sustainable. Again, we go back to, this isn't one and done. And if you know our 3-county region, I mean, the odds are kind of stacked against us, but we are making great strides with baby steps. So with that, I will turn it over to you, Dr. Pam.
Thank you, Lisa. So, we talk about cultural competency, and part of our commitment through the Multicultural Coalition is not just to go out and ask for partners and to look at their mission, all of that, but also that they are ready. They are ready to provide the services to these individuals at the level that they need them through a culturally informed lens, right? And so part of that is doing cultural competency journeys. And it's a very different take on, the whole cultural competency piece. A lot of times we think of cultural competencies and we think about trying to figure out other people and knowing who they are and all of that. But cultural competency starts with each one of us within that organization. And then the organization as a whole, understanding their organizational cultural competency, story and journey as well too. So one of the things that we've done is we've written into our grants opportunities to have these cultural competency journeys with key partners, key organizations that we feel that we want to do more referrals to, and we want to really help them understand and be ready for these referrals, right? So we write that into the grant, and we provide the cultural competency journey, sessions for them. It's sessions, and it's really diving deeper. And it's not about judging people or saying, you're doing this wrong or that wrong, or you need to change this or change that, but it's allowing them to help co-create that safe space where they can take a deeper dive into who they are and the lenses in which they use to make decisions, which ultimately ends up in the impact piece, right? And really shifting from intent to impact. Like I tell people, no one gets up, at least, the normal person doesn't get up in the morning and say, I'm going to go out there, I'm going to hurt all these people today, I'm going to commit all these microaggressions so that I can make people even more, marginalized or oppressed. We don't do that. We get up every morning, and our goal is, I'm going to go out and I'm going to make this impact. I want to help as many people as I can. I want to do my best, and I want to change lives. And that's what we do. And that's our mindset. But it's really shifting from, yes, that's a great mindset, that's a great place of intent, but ultimately our decision making is based on these lenses that we have that are entrenched with privileges, implicit unconscious biases, that then results in the microaggressions that we commit each and every day without even knowing that, without even understanding that we're doing that, right? So it's taking a deeper dive into individuals that work within that organizations, that comprise that organization, and then bringing them together collectively as an organization to develop an organizational journey and story that they can sustain. So when we look at this, and I look at this way. Cultural competency is the journey. EDI is the application of that journey. And that's where people get things mixed up, because we always put the cart before the horse, which means we always develop EDI initiatives and policies and procedures. But at the end of the day, who implements those? People do. And if we don't shift their lenses, why do we expect a different result? Because they're still using the same lens to implement those new policies and new procedures and all of that. Why do we think that that's going to change? So that's our take on cultural competency and how we, how we engage our partners that we've identified as critical partners for us. And we will build that list up, right? So we start with some key ones, and then we continue to build that. And we've seen it where we can write it into grants, and they have been approved for helping to really build sustainability, because our goal is to build sustainability and build capacity that then ultimately becomes sustainable within our community. So this is not a one-time thing. This is not a one crisis situation. And if we address it, then we can move on and everything will be fine, because we know that there's crisis happening in our community all the time in different aspects, different areas of our community. So I hope that answers your question.
Yes, very helpful. Thank you all.
And we always make the point, like, this is a journey. This is, our work will never be done. It'll never be perfect, but it's a journey. We keep going.
Of course.
And we're a learning community. I mean, every day there's something that always surprises us, something that we learn differently, something we look at differently. I mean, these are our sort of foundational pieces, but wow, there's not a morning we wake up and say, wow, I didn't expect to learn that today. Or, there's something that's always going to keep us moving forward to really try to make sure we're doing this right, but we're doing it in conjunction with the community, not for the community.
Definitely.
I want to make sure I'm not missing any raised hands as well.
This conversation could go on for a long time. This has
Yeah.
been wonderful. Thank you, everyone.
Yeah, I don't
Thank
see any
you.
more raised hands, and we haven't gotten any more questions in the chat, but it looks like we do still have quite a few folks on. So if you have any questions, now would be a great time to take yourself off mute or put that question in the chat.
And certainly reach out to us outside of this as well. We are happy to take questions, respond to emails, connect up with you. We are just an email or a phone call away.
Well, I think we may have gotten to all of our questions. So, and I know we're a little bit past the 15 minutes. And I know you all are willing to stay longer, but everybody needs a break too. So thank you again, Multicultural Coalition, for presenting at both sessions and sharing all of your great tips and good work with us. And very much looking forward to having the kind of finished product too that we can share with the broader learning community. I think it will be very helpful. But on behalf of the learning community, thanks again for joining us. And thank you to all of our workshop participants, and especially those of you who've stayed on until this point to listen to all the discussion and for sharing your experiences, sharing your questions. We really appreciate it. Hope you all have a great rest of your afternoon.
Thank you, everyone.
Thank you.
Thank you, everyone.
everyone.
Thank you.
You as well. Thank you.
Bye.